हेल्थ इज मल्टी डायमेंशनल. ओके, हेल्थ के डायमेंशन कितने हैं? मल्टी डायमेंशन है. नॉर्मली व्हेन वी सी द थिंग्स, दीज आर 2D length and width and 3D length, width and height. Like this room is 3D. Okay, and when we discuss about health, it is multi dimensions. Okay, it has many dimensions. The WHO definition tell us about 3 different dimensions. Okay, WHO की definition में कितने dimension थे? 3. कौन कौन से? Physical, mental and social. Okay, 3 dimensions were there. Now there are some more dimensions included in the health. These are spiritual dimension, emotional dimension, vocational dimension and some other dimensions. Okay, so if we want to study or discuss the health again in detail, we can think of the different dimensions of health. Okay, what is physical dimensions? First of all, we will study about physical dimension. The physical dimension of health is easiest to understand. Okay, we can easily understand the physical dimension of health, because physical health means what our body is experiencing. That is the physical health. Like when we are feeling pain, it means our physical health is not well. Okay, when we are having fever, it means our physical health is not okay. So this dimension is very easy to understand. The physical health implies the perfect functioning of our body. Okay, if our body is functioning properly, then it is known as we are physically healthy. Okay, the signs of physical health can be seen or experienced. Okay, if we are having good complexion, clean skin, bright eyes, lustrous hair, body well clothed, firm flesh, not too fat, sweet breath, good appetite, sound sleep, regular activity of bowel and bladder, and smooth and easy coordinated body movement. If these signs are there in our body, then we can say yes, we are physically healthy. Okay, so this dimension is known as physical dimension. The physical health again range in a quality along with the health scale. This physical health again, it is not fixed. Okay, as we have discussed in last class, that overall health is dynamic. It moves per day from time to time. In the same way, this physical health also have a range, starting from optimal health to extremely poor health. Okay, this is known as health scale. Okay, this between the health scale there are different diseases. Okay, which may include any disease such as cancer, diabetes, cardiovascular disorder, hypertension and any other physical problem. So okay, so these will imply the physical health, and it always moves from poor health to optimal health, and we are in between the range. Okay, अभी हम यहाँ बैठे हैं, we are sitting in this class. Some of us may feel optimum health, some of us may feel good health, and some of us may feel poor health, but still we are sitting here. Okay, and after 1 hour the person who was feeling poor health may come in the good health. Okay, so this always moves in between the health scale. So this feature of the health is known as dynamic system of the health. Okay, dynamics means continuously moving. Okay, so this is all about physical dimension. Second dimension is mental dimension. Okay, mental dimension is a bit difficult to understand. Okay, Physical dimension is very easy because we may experience any pain or fever, okay, but and just by watching the candidate we can find out that the person is physically healthy or not, okay. But the mental health is very difficult to understand, okay, because what is going on inside the person's mind we cannot understand easily. We have to imply some test, we have to talk to the candidate, then we can only understand. The mental health is not only the absence of mental illness. Again, mental health is also have a wide range, okay. If the candidate is not having mental illness, okay, any mental problem, even then we cannot say the person is mentally healthy, okay. We all are sitting here, okay, we are not mental we can say, na? In local language we are not mental, means we are not having mental illness, but still we may not be considered as mentally healthy. Some type of problem, mental problem, that we cannot say mental illness, but mental problem may be there. If mental problem, even stress, anxiety, these are also the type of mental problems. And if we are experiencing these, then we cannot consider ourselves as mentally healthy, okay. So again there is the range like we have discussed in the physical, okay. So what is good mental health? Good mental health इसको हम कैसे डिफाइन कर सकते हैं? How can we experience? As we have discussed in the environmental health, that how we are making the adjustment with the environment. In the same way, how we are making adjustment in our surroundings, with our friends, or how we are responding to the stressors or stimuli. This shows our mental illness. If we are responding properly, then we are in the good mental health, and if we are not responding properly, then we are in the bad mental health condition. Mental health is defined as a state of balance between individual and surrounding world, okay, and it is a state of harmony. Harmony means adjustment, harmony between oneself and others, okay, who are around us, maybe our family members, maybe our friends, and maybe our neighbors, okay. The mind and body are normally considered as independent entity, okay. Mind is different, body is different, but they work in close coordination to each other and they have effect on each other, okay. This is known as mind-body relationship, okay. If we are having any physical problem, it will affect our thinking, and in the same way, if we are experiencing any stress or mental disorder, it may affect our proper body function also, okay. So this is known as mind-body relationship, and the physical health and mental health, they affect each other, okay? And this example is given here, that some of the mental disorders or mental problems, they can include in the presence of hypertension, peptic ulcer, bronchial asthma, etc. Okay, if we are experiencing these problems, they can give rise to mental disorders, and even some mental disorders like depression, schizophrenia, they also have the underlying physical problem. Okay, so they affect each other.
फोबिया भी आता है।
हाँ, फोबिया भी आता है, क्योंकि that will also affect our physical health. Okay, so this is all about mental dimension of the health. Then third dimension is social dimension. Okay, so as we have discussed in last class, that anything which are happening in our society, it definitely affect our health. Okay, and this portion of health is known as social health. Social process, social functioning, and the ability to see oneself as a member of larger society becomes our social health. If we are sitting in the class and if we are experiencing that I am of a worth for this group, okay, all group members like me, okay, and they give respect to me. If we are experiencing this scenario, then we are socially healthy. And if we think, or if we experience that no one wants me, no one wants to talk to me, they are ignoring me, then we are socially sick. Okay, so this is how the social system will affect our health, and this is also known as the social dimension of our health. Okay, the person or individual is a part of family, okay, not separate, and the family is the part of society. So anything which is happening in the society will definitely affect the individual as well as the family. So this is all written here, that anything which our family is having the relation in the society with the neighbors, that will also affect the individual health, and this is the known as the social dimension of our health. Okay, so nothing else. Here we can just write 2 or 3 lines with this. Next one, these 3 dimensions already we have discussed in the definition given by WHO. But after that, some more dimensions are added to the health, and one important dimension is spiritual health. Okay, so what is the spiritual dimension? Spiritual dimension is the sense of overall purpose of life, that how we are having, why we are in this world, okay, and belief in a superpower, that is the spirituality. And definitely when we are having belief in a superpower, and during our problem situation, it may be physical health or anything, we call the superpower, okay, and when we pray, our willpower is increased and we move towards the positive health. Okay, that's why the scientists or everyone has understood or accepted the power of spirituality. That's why the spiritual dimension is also added in the dimension of health. Okay. After that, next one is emotional dimension. Okay. Emotional dimension क्या है? Emotional dimension means what? Our emotions also affect our health. Emotions like the continuous condition of our thinking or belief. The emotional health of the person is the person's mood. What is mood? Mood का मतलब क्या है? एक continuous state of thinking. Okay. For example, if we are thinking that I am healthy, it means I may feel the health for a few seconds, but after that again I may have some stress. This is not mood, but if the condition remains for some time, like 20 minutes or 30 minutes continuous state, that I am happy, or I am in grief, I am angry, then this mood becomes the emotional state. Okay, becomes the emotion. So these emotions also affect our health. This emotional health relates our self-esteem as well as our ability to control the emotion to maintain the realistic perspective of the situation. Okay. When we discuss about emotional health, we should realize that any emotional condition is realistic. Okay. If we hear or experience some bad news, then we may come in the state of grief for some time. Okay. But after a few days or few hours, we may come out of that state. Then we are healthy. Okay. Like you have told that I lost my brother. Okay. It was an event. We may feel bad for some days, but the life should go on continuously. After a few days, we should come in the normal life. If we are able to do this, then we are emotionally healthy. But if we are continuously experiencing the same emotion, then we may go into depression, or emotional health will go down, and it ultimately may enter into the mental illness. Okay, so this is all about emotional dimension of health. So every dimension have effect on the health. Okay. Next one is, it is the same, the feeling, vocational dimension. Okay, what is vocational dimension? Vocation means, what is the meaning of vocation? Vocation means the earning ability, how we are experiencing or earning something for our living. Okay, whether we are earning as per our education or as per our skill or not. Okay, if we are getting sufficient amount or earning as per our education, then we may feel good. Okay, and it will affect our health positive way. But if we are well educated, well experienced, but still I am not getting proper job or vocation or earning, then it may affect our health negatively. Okay. So this is the vocational dimension. But maintaining the vocational dimension is not in our hands. Okay, it is up to the society or our social, our political infrastructure, how we are getting. But still, the vocation dimension affects our health. Okay. Then, after writing these 5 points and few lines about them, then you can just mention their names and you can conclude your answer. You will write heading other dimension, and you can write that there are many more dimensions which affect our health. These are philosophical dimensions, cultural dimensions, socio-economic dimension, environmental dimensions, educational dimensions, nutritional dimension, curative dimension, preventive dimensions. Okay, so these are the dimensions of health. Okay, simple and very easy to write. ये क्वेश्चन यदि एग्जाम में